Ladies and gentlemen, welcome to today's lecture on skin tear assessment and management. Skin tears are a common type of wound that can occur in individuals of all ages, but they are particularly prevalent in the elderly population and those with fragile skin. In this lecture, we will explore the importance of skin tear assessment and management. We will discuss the causes and risk factors associated with skin tears, as well as the different classification of skin tears based on their severity and based on the International Skin Tear Association or Advisory Panel. We will delve into the assessment process for skin tears, including how to properly examine and document the wound characteristics. Additionally, we will discuss the factors to consider when determining the appropriate treatment for skin tears, including the use of various wound care products and techniques. Define skin tear. A skin tear is a type of wound that occurs when the layers of the skin are separated or torn, often as a result of trauma or friction. It typically affects the outermost layer of the skin, known as the epidermis, and may or may not involve in underlying tissues. Skin tears can vary in severity, ranging from minor abrasions to deeper wounds with tissue loss. The International Skin Tear Advisory Panel defines a skin tear as a traumatic wound that results from the separation of the skin layers due to shearing, friction, or blunt forces. Skin tears typically occur on extremities such as the arms, legs, and hands, but can also occur on other parts of the body. And by the way, remember that skin tears are considered as acute wounds. So they should follow the trajectory of acute wound healing. And we'll talk more about that later. Here's the risk reduction program. So, when you look at the skin, and the skin is very dry, and you also determine that they have a prior skin tear, and they the patient has an advanced age, and of course, advancing age means fragility of the skin. The first thing that you would do, ladies and gentlemen, according to guidelines, is you encourage the use of emollients. Emollients, these are the products that reduce the escape of moisture from the skin. So it's recommended not to use a traditional soap, and it's recommended that you use a warm water, cannot hold or hot water, but warm water. And you should also use a silicone tape and also cohesive retention bandages. So, meaning to say that instead of taping directly on the skin, you can use a cohesive retention bandages like Coban. And but not all Coban are safe for the skin, especially for the older population. And also encourage your patient to use a long sleeved instead of short pants. Okay, I mean, yeah, a long sleeve, and the use of long pants instead of shorts. And also, if they can have the resources to have one, it is encouraged that they can or they should use what we call the shin guards. Okay, so other area or opportunity that you can reduce the risks of skin tear is looking at their mobility. So if the patient has history of falls, impaired mobility, dependence for ADLs, or history of mechanical trauma, you encourage this patient to do some sort of exercise program, or better yet, refer them to physical therapy. You should also assess their footwears, like their shoes. Ask about lighting in the house to make sure that they have an adequate lighting, and you should also make sure that they don't have any obstacles at home. And if they have pets, you have to educate them on the risks and dangers of playing with pets. In real life, I have a lot of patients that I see who sustain falls, abrasions, scratches, excoriations, and if you ask them, they would tell you that they were playing with their pets. Next opportunity for you to reduce the risk for skin tear is looking at their overall, or what we call the general health. Look at their comorbidities, like what I mentioned earlier about polypharmacy. There are a lot of medications that cause the dehydration of the skin or increases the fragility of the skin. Also, take note if the patient has a cognitive issue or a cognitive problem, memory issue, decreased safety of awareness along those lines, and also take a note if the patient have some sort of malnutrition. So if this is the case, you have to make sure that the nutrition is optimized, and you need to make appropriate referral if any of this is happening, and you also make sure that they are well hydrated, and you educate them on the effects of medication and make referrals as appropriate. Here in your screen, you could see the skin tear framework for risk identification and prevention as recommended by the International Skin Tear Advisory Panel. So you assess the general health of the patient, the mobility status of the patient, and the skin condition of the patient. Okay, so if you see the or identify patients who are at risk, what would you do? Okay, you would implement what we call the skin tear risk reduction program. And then, if there's no risk at that particular time, you need to reassess the skin condition as soon as there is change of conditions. If, example, if the patient gets sick or the patient has a change in their functional status. Before they are independent, now they're having so much difficulty moving, or there's a change in their cognitive status, then you may have to reassess. But there are three major things that you are thinking about is you're going to assess their general health. So, and with this, you're going to find out if this patient has a chronic or a critical diseases, and if they are taking a lot of medication, or what we call this polypharmacy. Remember, ladies and gentlemen, that there are some medication that predispose the skin to more fragile situation. And also, if the patient has cognitive, sensory, visual, auditory, or nutritional status, you should label this patient to be at risk. And their mobility, if you know that they are having some difficulty there with their mobility, you have to make sure that you have to address that properly, and a referral to physical therapy may be indicated. So let's talk about the risk factors and causes associated with skin tear. Some common risk factors include number one, advanced age. Older adults have weaker and thinner skin, making them more prone to skin tears. Number two is fragile skin. Conditions like cirrhosis, meaning dry skin. If you watch my video on cirrhosis, you would know that cirrhosis is a technical term for dry skin. And also, people with certain medical conditions such as malnutrition or dehydration, this can all make the skin more fragile and susceptible to skin tears. Number three is chronic health conditions. Diseases like diabetes, peripheral vascular disease, and venous insufficiency can compromise the blood flow and weaken the skin integrity. This will increase the risk of skin tears, as you would imagine. Number four, immobility or limited mobility. Individuals who have limited mobility or are bedridden have a higher risk of friction or shear injuries, leading to skin injuries. Number five, ladies and gentlemen, is cognitive impairment. People with cognitive impairment or dementia may have difficulties understanding and adhering to preventive measures such as wearing appropriate clothing or assisting with personal care, making them more susceptible to skin tears. Number six is history of previous skin tears. So a history of prior skin tears will always put the patient at high risk of developing the same. Once a person has experienced a skin tear, the affected area becomes more vulnerable to future tears. There are various causes of skin tears which can include number one, friction and shear forces. Activities such as dressing, transferring, or repositioning can create friction or shear forces that may cause the skin to stretch, tear, or break. Number two is accidental trauma. Any external trauma, such as bumping into objects or falls, can cause skin tears. Number three is medical procedures. Certain medical procedures, including blood draws, wound dressing, or tape removal, can potentially cause skin tears if not done properly. So I'm very guilty of this. I will be lying to you guys if I tell you that if I tell you that I have never caused any skin tear in the past. Like years ago, I was removing a dressing or the tegaderm, okay, in particular, from a lady in a nursing home, and unintentionally I was able to uh, I technically I ripped the whole skin while I was doing or removing the tegaderm dressing. So from the on, I never do that without using very good adhesive removers. So if you want to know what particular brand I use for that purpose, you can always comment at the or write that down on the comment section, or you can always private message me. Okay, number four cause that could be attributed to skin tear will be a rough or abrasive surfaces. Interactions with rough surfaces, sharp objects, or abrasive materials can lead to skin tears. Number five, inappropriate clothing or footwear. Clothing with rough seams or materials that do not fit properly can contribute to skin tears. Similarly, ill fitting or inappropriate footwear can increase the risk of falls and subsequent skin tears. So, preventive measures such as maintaining proper hydration, moisturizing the skin, using appropriate skin care products, employing safe transfers and repositioning, and providing education to caregivers and healthcare providers can help reduce this risk and the occurrence of skin tears. So, like what we said earlier, is identifying the people who are at risk, um, and knowing the different causes of skin tear would dramatically help us reduce the incidence or the prevalence of skin tear in our elderly population. So, the prevalence of skin tear in the United States varies widely depending on the population observed and, of course, the setting being studied, particularly those in long term care facilities. According to a systematic review published in the journal Advances in Skin and Wound Care, the prevalence of skin tears in long term care settings range from 4.5 to 35.5%. That is relatively high. Another study conducted in nursing home reported a prevalence rate of 9.4%. However, in acute care hospital settings, the prevalence of skin tears has been found to be lower, according to a study published in the Journal of Wound Ostomy and Continence Nursing. The overall prevalence of skin tears in acute care hospitals was 1.5%. So, the International Skin Tear Advisory Panel has developed a classification system for skin tears based on the severity and depth of the wound. The International Skin Tear Advisory Panel classification includes three categories. Number one is Category 1, or also known as Type 1. In this situation, there is no tissue loss. The skin tear involves a separation of the epidermis from the dermis without any tissue loss. So the wound edges are easily realigned and the skin is intact. Meaning to say that it's not really intact, but say for example, if this is a skin tear, right? And then you try to clean, and then after that you try to realign the flap, and you're able to cover the whole injured skin, and there's no visible gap. Then it's what we call type 1 or category 1. So the whole skin flap were able to be realigned and recovered the injured um, skin area. So that's what we call category 1 or type 1. So when you say type 2, there's a partial loss of the um, of the skin. So here, the skin tear involves a partial loss of the dermis or epidermis. The wound edges cannot be easily realigned, and there may be a visible flap or partial loss of the tissue. So as you can see in the picture, um, you try to realign, but you lost some of it. That's the reason why the whole wounded area um, is not completely covered by the flap, but you're able to save some of them, but it you're not able to cover the whole area. So that is category 2, or what we call type 2. And I want that to commit that you guys to commit that to memory. So first, when you say category 1 that we just talked about, is you realign the skin flap and you're able to cover the hole. So there's no gap. That's category 1 or type 1. Okay? When you say type 2, there's a partial skin loss. So you're not able to preserve the flap 100%. So when you realign, okay, you see a gap, and that's what we call type. Now, when you say category 3, there's a complete tissue loss. The skin tear involves complete loss of the epidermis, dermis, and uh, sometimes the subcutaneous tissue is also involved. The underlying structures such as a muscle, tendon, or bone may be exposed, but the distinguishing mark of category 3 or type 3 is that there is no preservation of the skin flap. So it's totally gone. Okay? So when you see that, that is what we call skin tier category 1, or I mean category 3, or type 3. Okay, so each category is further classified based on the extent of tissue loss in the presence or absence of tunneling or undermining. But the newer classification system, which is going to say type 1 or category 1, type 2 or category 2, type 3 or category 3. Type 1, no skin flap loss, 100% covered. Number 2 or type 2 or category 2, there's a partial skin loss. Okay, you're not able to cover the injured skin 100%. Okay, you lost part of your flap, skin flap. And category 3 or type 3, there is a complete tissue or skin flap loss. Okay, so the whole wounded area is exposed. Ladies and gentlemen, there's so much information. We need to take a break. Click part 2. See you there in a second.